Hi, I'm Dr. Louis Su from University of Illinois, and I'd like to talk about our project.
Children born with sickle cell disease, an inherited blood disorder, have as much as a 400-fold higher chance of dying of infection, leading to an under-5 mortality rate of 50 to 90%. However, if they're known to have sickle cell, we will treat more aggressively with antibiotics and give preventive antibiotics. This strategy has been highly successful in saving lives in the developed world. However, how do you bring this to a low-resource country? How do you do the newborn diagnosis and treatment? That's what this project is about. Scalable, low-cost, community-based screening and treatment of newborns with sickle cell disease. Let me tell you some of the key features. The screening test for hemoglobin will be how a treated drop of blood spreads on a filter paper. If it spreads very little, that's sickle hemoglobin. If it spreads widely, that's normal hemoglobin. If it has both, that's sickle trait. Treatment of the children with sickle cell disease will be at University of Ibadan University College Hospital. This is a community-based program, both for education of the families of children newly diagnosed with sickle cell and for tracking and ascertainment of those who fall ill or die. This is embedded within the AfriNest program for neonatal sepsis tracking, led by Dr. Ayede with backing from WHO and Gates Foundation. And we will bring in implementation science to analyze the pieces of this demonstration project that work, figure out how to adapt them, and to scale them up to other places for newborn screening to save more children. Sickle cell affects people all over the world with early deaths as well as incredible pain, but Nigeria is the place in the entire world with the most births with sickle cell. Millions of babies born by 2050 and at risk for early death, and that's why Nigeria is the place to start. This project builds upon existing relationships with Ibadan and elsewhere in Nigeria. We also have an independent third-party observer to verify the project, senior pediatrician with research experience, Professor Akimbami, former head of pediatrics at Niger Delta University.
In this project, we should be able to bring together the new filter paper-based low-cost screening test, the infrastructure to be able to detect newborns and treat them for illness at the University of Ibadan, as well as use implementation science to be able to bring all of this to the next level and be able to save a lot more lives.